2020 coronavirus regulations, this meeting is being held virtually to facilitate attendance and enable consideration of important matters during the current COVID-19 situation. The meeting will therefore operate differently in that members of the Cabinet joining in remotely are still able to contribute and vote on any matter. I would ask all attendees tuning to mute their microphones unless they have been invited to speak. If anyone wishes to speak, please use the hand up icon in the messaging bar or send a message using the message icon in the middle of the screen indicating you wish to speak. And I will invite you in turn to put on your microphone at the appropriate point. When you are finished speaking, please remember to turn off your microphone again. Following questions and a debate, in order to make a decision on the item, I will ask the Chief Executive to ask Cabinet members whether they are for, against the proposal or if they wish to abstain. Please note that this meeting is being live streamed via the Council's website and will also be available to view by members of the public and the press who are allowed to film by law. Audio record, take photographs, blog or tweet at this meeting. I will now ask all Cabinet members and scrutiny members present to introduce themselves. I am Councillor Maria Crompton and I am the Statutory Deputy Leader for the Council. Councillor Ali. Councillor Ali.
My microphone was off. Councillor Ali, Cabinet Member for Resources and Core Services.
Thank you. Councillor Alcock.
Councillor Keith Alcock, Cabinet Member for Homes.
Thank you. Councillor Hadley.
Councillor Hadley, Cabinet Member for Safer Communities.
Councillor Padda.
Councillor Iqbal Padda, Cabinet Member for Community Engagement and Equality.
Councillor Shaheen.
Councillor Farah Shaheen, Cabinet Member for Living Healthy Lives.
Thank you. Councillor Singh.
Councillor Rajbir Singh, Cabinet Member for Skills and Employment.
Councillor Taylor.
Good afternoon, everybody. Councillor Jackie Taylor, Cabinet Member for Sustainable Transport.
Councillor Underhill.
Good afternoon, Councillor Joyce Underhill, the Cabinet Member for Best Start in Life.
Right, now we move on to scrutiny chairs. I've got a note here saying that Councillor Elaine Giles could possibly be a little late. I don't know whether she's here. I can't see a picture showing, so we'll move on to Councillor Paul Moore.
Paul Moore, Chair of the Safer Neighbourhood Scrutiny Committee.
Thank you. Councillor Preece.
Thank you, Chair. I'm Councillor Liam Preece. I'm Vice Chair of the Children's Services and Education Scrutiny Board.
And Councillor Rollins.
Councillor Laura Rollins, Chair of Economy, Skills, Transport and Environment Scrutiny Board.
Okay, we will now move on to the agenda. Apologies for absence. We've got apologies. Oh, okay. I've got apologies here for Councillor Millard, Councillor Luke Giles, Councillor Elaine Giles may be attending later. Okay, so we can move on to the minutes. The minutes of the meeting held on the 22nd of July 2020 are presented. I hear them as a correct record. Do we have a seconder? Councillor Ali, can you do that?
Yeah, happy to second the minutes.
Thank you. Are they all approved?
Aye.
Yeah.
Aye.
Aye.
Thank you. Okay, agenda item 3, members to declare interests in matters to be discussed at the meeting. Have we got any matters to declare, anyone? No? Okay. We will then move on to agenda item 4, additional items of business. We have no additional items of business today, but I would like to take the opportunity to outline some changes I have made to Cabinet portfolios with effect from today. Regulatory functions, for example, licensing responsibilities, etc., are being transferred from Living Healthy Lives portfolio over to Safer Communities portfolio. This was changed previously when I held the Safer Communities portfolio, but it's now being changed back again as I no longer hold that portfolio. The forward plan will be amended to reflect those changes. We'll continue now with the items of the scheduled agenda. Agenda item 5, NHS COVID-19 discharge requirements. If I can ask Councillor Shaheen to present that report, please. Councillor Shaheen, are you there?
Yeah, I am. Thank you. This report presents S75 Partnership Agreement for the Better Care Fund 2020-2021 and variation to incorporate the NHS COVID discharges funding. During the COVID crisis, the government has required hospitals to discharge all patients as soon as they are clinically safe to do so, with the NHS fully funding the costs. This includes support to get people out of the hospital and to prevent hospital admissions to reduce the pressure on acute services. Health partners were allocated additional funding to support this activity, but we had to find a means of pooling the funds to satisfy the government's requirements. Sandwell and West Birmingham CCG and Sandwell Metropolitan Borough Council already have a Section 75 agreement in place to jointly operate the Sandwell Better Care Fund programme. It is proposed to extend this Section 75 agreement to include the additional funding from health. Therefore, Cabinet are asked to approve the proposal to incorporate the NHS COVID discharge requirements into the Better Care Fund S75 agreements to enable the Council to access the available funding. Delegate authority for the DAS to sign off the variation on behalf of the Council. Thank you.
Okay, thank you for that. Have we got any questions from anyone? Have we got any hands up, David? No?
No questions, Chair.
Okay. In that case, we'll move to the recommendations of the report and vote for, so that the Chief Executive can call each member out and you can say what your vote is.
Sorry, Chair, I've got a hand up from Elaine Newsom.
Oh, okay. Elaine?
Have notification that the sound has stopped broadcasting. Please can we just pause the meeting for a few moments while we try and rectify the issue?
Yeah, okay.
Thank
okay.
you.
For a moment, because the equipment has gone dodgy again.
Chair, we may need Councillor Shaheen to repeat her introduction to the report with apologies. We're just trying to find out at what point the sound stopped.
we'll ask them to read.
Are we back?
Yeah.
Okay, hi everybody. We've got technical problems, so we're going to adjourn until 4:15. If you can all hang about, and we will have to live screen again at 4:15. I think David's got some details he wants to tell you.
Yeah, so could I ask everybody to log back in at 4:15, please?
Sorry, we seem to be back on again. Just been told.
Okay, slight change of plan. Just bear with me a second,
So where are we
please.
going to pick up from? Okay, it's really, oh, we've still got the screen on. Is that going to come off?
Yeah, we're supposed to screen to come.
Okay, well, we appear to have the gremlins in the works again. So sorry about that, anyone out there that may well be watching. Because the live feed went down, I think we're going to have to go back slightly to the item 5, which is the NHS COVID-19 discharge requirements. Councillor Shaheen, I'm sorry, but could you just do that again, please? Because I think the public missed what happened. Thank you.
Okay, that's fine. Thank you. This report presents S75 Partnership Agreement for the Better Care Fund 2020-2021 and variation to incorporate the NHS COVID discharges funding. During the COVID crisis, the government has required hospitals to discharge all patients as soon as they are clinically safe to do so, with the NHS fully funding the costs. This includes support to get people out of the hospital and to prevent hospital admissions to reduce the pressure on acute services. Health partners were allocated additional funding to support this activity, but we had to find a means of pooling the funds to satisfy the government's requirements. Sandwell and West Birmingham CCG and Sandwell Metropolitan Borough Council already have a Section 75 agreement in place to jointly operate the Sandwell Better Care Fund programme. It is proposed to extend this Section 75 agreement to include the additional funding from health. Therefore, Cabinet is asked to approve the proposal to incorporate the NHS COVID discharge requirements into the Better Care Fund S75 agreements to enable the Council to access the available funding. Delegate authority for the DAS to sign off the variation on behalf of the Council. Thank you.
Thank you, Councillor Shaheen. Any questions, anyone? No, can't see any. No, okay. In that case, we'll move to the recommendations. If the Chief Executive can call each member and ask them to confirm their vote, please.
Okay, thank you very much, Chair. Councillor Crompton, for, against or abstain?
For.
Councillor Ali, for, against or abstain?
For.
Councillor Alcock, for, against or abstain?
For.
Councillor Hadley, for, against or abstain?
For.
Councillor Padda, for, against or abstain?
For.
Councillor Shaheen, for, against or abstain?
For.
Councillor Singh, for, against or abstain?
For.
Councillor Taylor, for, against or abstain?
For.
Councillor Underhill, for, against or abstain?
For.
I think we got that, Joyce. Okay, thank you. Everyone is in favour, so that report is approved. If we then move on to agenda item 6, which is the climate change strategy, if I can ask Councillor Ali to present that report, please.
Thank you. So in January of this year, I brought a draft climate change strategy to Cabinet, seeking approval to submit a 2-month period of public consultation. This involved a series of public meetings, as well as an online survey, giving residents and others the opportunity to share their views on our proposals for addressing the challenges of climate change. Following the results of the public consultation, along with the new evidence about challenges for addressing climate change, this report seeks to support the revised climate change strategy subject to approval at full council and the endorsement of the corporate targets of carbon neutrality of Sandwell Council and the wider borough. Despite the challenges which the current pandemic poses, climate change remains the most significant long-term threat to our existence. Fortunately, although there is now a large body of evidence showing how climate change impacts us all, the UK levels of carbon dioxide are continuing to rise each year, and our climate is warming and becoming increasingly unstable. In March of this year, we joined many other councils across the UK in declaring a climate emergency, in recognition of both the seriousness of the threat and that climate change poses, and the urgency required from our responses. The climate change strategy includes two key targets. Firstly, that our own estate and operations will be carbon neutral by 2030. And secondly, that the borough will be a carbon neutral by 2041. 2041 is also the target set by the Combined Authority for Carbon Neutrality. As well as outlining the scale of the challenge for dealing with climate change, the strategy involves a high-level action plan designed to meet our target dates of 2030 and 2041. The action plan covers our own estate and operations, the built environment, transport, waste and recycling, adaptation and resilience, and natural capital. Key to our success will be partnership working with our residents, our businesses, and the wide range of organisations with which we already work. We need to lead by example too, and be willing to address existing ways of working to help decarbonise our economy and embrace a new circular economy. The benefits of addressing climate change are widespread and include improved air quality, reducing fuel poverty, ensuring the long-term viability of our businesses, enhancing the image of Sandwell through our extensive programme of tree planting and improvements in the health and quality of life to our residents. I recommend that Cabinet approve this report so you can take it to full council for the final approval. Thank you.
Thank you, Councillor Ali. Have we got any questions? David, have we got any hands up?
No hands up, Chair.
Okay, in that case, we will move the recommendations to the report and vote. Can the Chief Executive call each member and ask them to confirm their vote, please?
Thank you. Councillor Crompton, for, against or abstain?
For.
Councillor Ali, for, against or abstain?
For.
Councillor Alcott, for, against or abstain?
For.
Councillor Hadley, for, against or abstain?
For.
Councillor Padda, for, against or abstain?
For.
Councillor Shaheen, for, against or abstain?
For.
Councillor Singh, for, against or abstain?
For.
Councillor Taylor, for, against or abstain?
For.
Councillor Underhill, for, against or abstain?
For.
Thank you, Chair.
Thank you, everyone who's in favour, and so that report is approved. We move now on to agenda item 7, which is dynamic purchasing system for the provision of passenger transport for 2021 to 2025. Can I ask Councillor Underhill to present that report, please?
Thank you, Leader. The Council has a statutory requirement to establish a system to provide transport services for children and adults who've got special educational needs and disabilities. And this report seeks approval to establish a new dynamic purchasing system for the period the 1st of August 2021 to the 31st of July 2025. Current contracts are due to expire on the 31st of July 2021, and going for this option of providing transport will ensure that the council can be responsive to changes in the market and also the demand for the service. So I recommend this report to Cabinet. Thank you.
Thank you, Councillor Underhill. Do we have any questions on this report? David?
No hands up, Chair.
Okay, in that case, we will move to the recommendations on the report and vote. And can the Chief Executive please call out the members' names and ask for their vote?
Councillor Crompton, for, against or abstain?
For.
Councillor Ali, for, against or abstain?
Councillor Ali? Have we lost Councillor Ali?
Councillor Ali, your mic's off.
Sorry. For.
Thank you.
Thank you.
Councillor Alcott, for, against or abstain?
For.
Councillor Hadley, for, against or abstain?
For.
Councillor Padda, for, against or abstain?
For.
Councillor Shaheen, for, against or abstain.
For.
Councillor Singh, for, against or abstain. Councillor Taylor, for, against or abstain.
For.
Councillor Underhill, for, against or abstain.
For.
Thank you, Chair.
Okay, thank you everyone. Seems to be in favour, so that is approved. We move then to agenda item 8, which is Q1 budget monitoring. Can I ask Councillor Ali to present this report, please?
Yes, thank you, Chair. So the projected year-end position at director level, excluding public health and the housing revenue account, is an underspend of 1.232 million. The position including public health and central items is a projected underspend of just over £2 million. Although any underspend against public health grant is ring-fenced and has to be transferred into the public health reserve. This excludes the impact on business rates and council tax and some commercial income, which is outside of directorates. The projection includes the use of 12.1 million of reserves and a one-off corporate resources that have been previously earmarked for use by those services. It also includes the use of 11.8 million of COVID-19 emergency grant funding. The report and appendices provide a breakdown of this projection across the directorates together with reasons of the variances. In respect of COVID-19, grants of approximately 108 million have been received related to COVID-19. The majority of these are ring-fenced for specific purposes, a significant proportion are passported to local businesses and community. Within this amount, 25.1 million of unring-fenced emergency funding is available to fund a range of pressures currently being experienced. As outlined earlier in the report, 11.8 is funding pressures in directorates against central items. The remainder will be used to fund the loss of some commercial income, business rates, and also council tax income, and the delayed delivery of some budget savings. There are a number of assumptions and variables in the projections, including it is assumed that there will not be a second COVID-19 wave later in the year and no local lockdown. It is not currently possible to quantify the potential impact of social distancing measures from September on transport budget pressures within children's services. This was relatively early in the financial year to assess the potential loss of business rate and council tax income. The wider impact on the economy as the year progresses is likely to affect those projections. Details of the MHCLG's funding for loss of income are yet to be received and is not included in these projections. It is anticipated that there may be a surge in referrals to SCT in September when all pupils return to school. No additional expenditure has been included in the projections for this. No costs have currently been included for the changes required to office space for social distancing. The more staff return, no funding of equipment of staff to work from home if it is decided that this will be continued for a long-term basis. Cabinet should be aware that the business rates and council tax income shortfall will impact on the budget for 2021-22. As a deficit on this is carried forward and recovered in the following financial year, the MHCLG has announced that this can be now spread across the 3 financial years instead of 1. The impact of COVID-19 will therefore continue to create pressures on the council's budget across the period of the medium-term financial strategy, and work is now being taken place to estimate the impact that this will have on our future funding levels. As a breakdown by directorate, in resources, an overspend of £700,000 on legal and governance, offset by various savings across the remainder of the directorate. Adult services, an underspend of placements, 1.749 million, contingency budget of 1.5 million not required, and other savings such as vacancies. Regen and growth overspent of 1.405 million, mainly due to property maintenance account. Housing and communities underspend of 0.864 million, mainly vacancies related. Loss of income is expected to be funded by the emergency grant, and children's services overspent of 3.1 against Send Transport. So in terms of this report for Q1, the recommendations I'm asking Cabinet to approve today are to receive the monitoring position and refer the budget to the Budget and Corporate Services Scrutiny. Note that the current financial position, approve certain environments above £200,000, approve the allocation of 0.31 million to Sandwich Children's Trust to fund COVID-19 pressures. The money that's going to come from the COVID-19 emergency grant, approved 2 appendices which are admitted to the budget report to full council in March 2020, and approved the budget transfer of £300,000 from central items to housing communities. This budget previously relates to the carbon reduction programme, which is now ended, and it's proposed that this now be used to support the climate change strategy. I move this report to Cabinet. Thank you.
Thank you, Councillor Ali. Have we got any questions?
No hands up, Chair.
Okay, thank you. In that case, we will move to the recommendations of the report to vote, and the Chief Executive can call on members and ask them to confirm their vote, please.
Thank you. Councillor Crompton, for, against or abstain.
For.
Councillor Ali, for, against or abstain.
For.
Councillor Alcock, for, against or abstain.
For.
Councillor Hadley, for, against or abstain.
For.
Councillor Padda, for, against or abstain.
For.
Councillor Shaheen, for, against or abstain.
For.
Councillor Singh, for, against or abstain.
For.
Councillor Taylor, for, against or abstain.
For.
Councillor Underhill, for, against or abstain.
For.
Thank you, Chair.
Okay, thank you. Everyone appears to be in favour of that report, so that is approved. I must apologise to anyone watching for our problems with IT. I'm sure at one point we may manage to get through a meeting without any problems, but we'll endeavour to do so in future anyway. Thank you very much, and with that I will close the meeting. Thank you.